So big welcome to the viewers of D-Life channel. So today we have an eminent personality in the low carb world, Dr. David Unwin from UK, who is also known as the low carb GP in Twitter. So Dr. Unwin, it really gives me pleasure to welcome you to D-Life, to welcome you to India, the capital of diabetes. And I'm sure you will be sharing your knowledge, the revolutionary way in which you are treating your patients.
Thank you.
Welcome, doctor. So viewers, now it's really a pleasure for me to read out the credentials of Dr. Unwin. So I'm going to actually read it verbatim, word by word. Dr. David Unwin, FRC GP, works at the Norwood NSH surgery in Southport, near Liverpool, UK, where he has cared for the same population since 1986 as a family doctor. To date, 82 of 166 of his patients with type 2 diabetes have achieved a drug-free remission. This gives a remission rate of 49% at 30 months duration of a low-carb diet, one of the best results for any clinic in the world. For the past few years, he's been a UK Royal College of General Practitioners expert clinical advisor on diabetes. As a result of his interest in better communication with both patients and type 2 diabetes, he was made the Royal College of General Practice National Champion for Collaborative Care and Support Planning in Diabetes and Obesity in 2015. In 2016, he was the proud UK national winner of the NHS Innovator of the Year award for the published research into lifestyle changes, working with patients, personal health goal as an alternative to drug therapy in type 2 diabetes. So his GP practice spends approximately £50,000 less per year as expected on the drugs for diabetes. As a part of this, he is also published researches into improving blood pressure, diabetes, liver function by reducing dietary carbohydrate intake, especially sugar. In 2019, he was shortlisted by NICE or NICE for a prize for his teaspoon of sugar infographics, which are now being translated into 6 different languages. Dr. Unwin's work has been covered by BBC, C4 and CY Television, The New Scientist, The Times, the Daily Mail, and the BMJ, British Medical Journal. Further recognition came recently when Dr. David was invited to become an ambassador for the UK All-Party Parliamentary Group on Diabetes. So he's known as the famous, the low carb GP in Twitter with more than 51,000 followers as on date. So Dr. Unwin, the low carb GP, I again welcoming you to D-Life, welcoming you to India. So please do tell us something about your work, how you came across this low carbohydrate way of life.
Thank you.
Over to you, doctor.
Thank you. So it's a great pleasure to speak to an audience in India. Here I am in the north of England. It's just raining gently outside, but we're hoping for some sunshine later, a thing we don't get much of. But really, we should talk about my work. So as you've already heard, I've looked after the same population of 9,000 patients since 1986, a long time. I think what's important is for the first 25 years, I was looking after that population, relying almost exclusively on prescribing drugs. What I noticed was the results were very disappointing. I didn't see people who seemed to improve in their health. They mainly seemed to get heavier and less well. And then one day, a single patient changed my entire life back in 2012. So this lady had annoyed me because I knew she wasn't taking her prescriptions. She wasn't taking the drugs I was prescribing for her. So I invited her to come and see me so that we could discuss why she wasn't taking the medication. But when she arrived, I was amazed. She was a transformed woman. She looked so healthy. She'd lost stones in weight and was beautifully and fashionably dressed, a thing she hadn't been able to do previously because she was so heavy. When we did the blood tests, she had put her diabetes into drug-free remission. In 25 years of clinical medicine, looking after thousands of patients, I'd never seen diabetes put into remission. I was utterly fascinated as to what she'd done. She explained to me that actually what she had done to improve her diabetes was very, very simple. She had understood that if diabetic control, if good diabetic control is about reducing your blood sugar, it makes no sense to eat sugar. So she had cut back on not just sugar, but the dietary carbohydrates that digest down into sugar. And she explained to me, she said, surely, Dr. Unwin, you're a medical man. You understand that bread digests down into large amounts of sugar and that rice also turns into sugar. Surely these food items cannot be a sensible thing for somebody with type 2 diabetes to be eating. And when she made that point, I understood instantly. I'd been making a terrible error for 25 years because I hadn't really thought properly about diet and sources of glucose, the sugar that is the problem for somebody with type 2 diabetes. So from that very day, somewhere around the end of 2012, I personally went on a low-carb diet. So I've now been on the low-carb diet. I suppose it's over 7 years. And I noticed very soon I wasn't hungry. I'd lost weight. My blood pressure improved. My belly went smaller. That was one of the first things I noticed. And so I think a thing you experience personally is something you believe in. And I learned so much from that lady. And then we started, my wife, Jen, is a consultant clinical health psychologist. And she and I together started running a low carb group in the practice. That group's been running now for 7 years and is the basis for the data that I publish. So I think that's a reasonably full answer to your question. So a patient changed my mind about how to best help people with type 2 diabetes.
I think that has been a strength of yours that, you have actually, we usually learn from doctor, but as a doctor, you have learned from a patient. And probably that one incident has helped you,
Yes.
help a lot of other patients.
Well, I would say it's helped open my mind. I think each of us should be open to a change. If what you're doing isn't working, why would you continue to do the same thing? And I was so depressed with the results of my care because the patients, I just prescribed one drug and then I'd add another one and a third one. And that form of medicine was not satisfying to me because the patients were not truly healthy. I knew that. And I was actually considering retiring from medicine, in part because I was so disappointed. I think the ability to admit I was wrong is useful. And it's enabled me to learn from a great many people all the way around the world, some of whom have appeared on your website, I understand, because there are some remarkable brains thinking about the epidemic of type 2 diabetes. And another thing I'd like to add, I had noticed that within my patients, between 1986 and 2012, there had been an 8-fold increase in the number of people with diabetes, 8 times more.
Wow.
And that worried me. Where was it leading? So all the drugs I was prescribing, there were 8 times more people with diabetes. I understand something very similar is happening in India. And, in our grandparents' generation, I'm not sure they were as fat, and I'm not sure they were as sick with diabetes. Certainly that's the case for my patient population. When I was a young man, many years ago, I hardly knew of anybody with type 2 diabetes in my family or in my community. And now, so many people are unwell with type 2 diabetes. And on a daily basis, I'm seeing personal tragedy for people. And I just feel we must do something. We must do something. I'll shut up now and let you ask another question.
It's really amazing. And to add to what you have said, I also have a similar experience. So I am also a type 2 diabetic, diagnosed somewhere in September 2015 with a HbA1c of 7.2. And my HbA1c later on, once I've adopted low carb ketogenic diet, it ranges from 4.7, 4.8, 4.9 max. It never crosses 5. And yes, it's a challenge.
That's a wonderful result, though, isn't it? And so cheerful, and particularly if you've done it without any drugs at all. Is that right?
Yeah, that's true. I was on metformin for 1.5 years initially. So
yes.
That's how. But later on, after 1.5, 2 years, I knocked off. So last 2 years, there are no drugs.
Well
no
done.
allopathic, no Ayurvedic, no homeopathic, nothing. So I don't.
And we want many, many more cases like that all the way around the world. I ought to just interrupt with a sort of health message. And that is, I would never advise anybody to come off the medication that their doctors have prescribed. And I would never advise anybody to think that what I'm giving is personal advice against what their own doctors do. So all of this is for general interest and advice rather than personal advice. That's just a little safety point.
I think that is very true, and there is always a caveat to this.
Yes.
Low carb or lower carb or ketogenic diet or LCHF, whatever works, but then it has to be done under the guidance of a medical practitioner who will support, and also a dietitian or nutritionist who has knowledge on how to give an optimal diet. So nothing has to be done without the support of these two individuals, because if patients just get off medication, they will likely to be land up with very dangerous conditions and possibly many of the complications which we don't want. So for the viewers also, again, as Dr. Unwin has said, so it should not be done impromptu. So it has to be done under the guidance of a medical practitioner or a nutritionist. So that's how.
Yeah.
So yes, sir.
I was just going to say, I think the thing that really helps people, that interests me, is helping people with type 2 diabetes to a better understanding of their condition, to the physiology of their condition. And then they're in a better place themselves to judge which advice is the best. So I do think it's worth thinking about the actual physiology, the reason at a cellular level why you have diabetes.
So I also understand that diabetes is also associated with other conditions like fatty liver disease and hypertension.
Yes.
And we also see, such cases go into remission. Hypertension is resolved. Fatty liver just goes away, just disappears within few months. So how is your experience?
Yes.
I'm sure you must have seen this also in your practice as a cluster.
Well, I have. I was so amazed at the beginning. The number of different conditions that started to improve. So that the first thing people noticed was they weren't hungry. Sometimes, in fact, I wasn't hungry. I was a very greedy person, always wondering about the next meal and finishing off my children's food before they'd hardly finished it themselves. And I discovered within a few weeks, I wasn't hungry. And patients were saying to me, do I have to eat breakfast? Because, I'm not really hungry. That was the first thing. And then I noticed personally that if I stood up too quickly, my blood pressure was a little low, which was amazing because up until then I'd been developing essential hypertension. And then on top of that, patients their belly, particularly the belly, was just shrinking. They were saying, I've got to buy entire new wardrobes of clothes because my tummy's so much smaller, a thing they really liked. And then because of the novelty of the approach at the time, I was doing a great many blood tests to check on my patients to see how they were doing. And the thing that impressed me at the very beginning was rapid improvements in liver function. And this was because I think around the world, a fifth or 20% of the entire developed world has non-alcoholic fatty liver disease. And these cases were improving, just as you say, within weeks, on top of dramatic improvements in blood sugar. So we were seeing improvements in blood pressure, blood sugar, liver function, and some aspects of the fasting lipid profiles were improving as well, particularly the triglyceride levels. And I was so fascinated. Every day I couldn't wait to open up the blood test results, a thing that I used to find very boring. But I found that looking at my patient's blood test was so fascinating, I left it as a treat for the end of the day to make the day worthwhile, because so many of the results were positive, a thing I had never seen in 25 years. So you're absolutely right. What we're seeing here is improvements not just in diabetes, but blood pressure, waist circumference, liver function, and particularly serum triglyceride levels as part of the fasting lipid profile. And many other conditions, I could go on and on. Skin condition, particularly, that's one of the first things I see is people's skin improving, which young people particularly appreciate, but also obviously some of the older ones.
So I think this is a similar condition even which I was diagnosed with grade 1 fatty liver a year before I was diagnosed as a diabetic. So doctor prescribed vitamin E and told me to reduce fat, so as usual, so which I continued. But later on, once I started the lower carb diet, so everything got resolved, belly fat went away, and of course I had to dispose of the wardrobe, all these 24 pants, and then buy a fresh set. Don't mind spending on this, of course. So in day life, we also see a lot of other cases getting resolved. People getting off antihypertensives. In fact, we had a case where one of the members was taking as much as 4 antihypertensives and still was not controlled, and he was going to be put on one more antihypertensive. And then he started lowering down his carb, and then today it is around 1.5 years. He is off all medication, very, very extremely happy.
Yes.
He was a pre-diabetic.
You may know, just to interrupt, you may know that last year I published a paper on this blood pressure condition, because we found the improvements in blood pressure on average, I think, were 11 millimeters of mercury for the systolic and 6 millimeters of mercury for the diastolic. An important point is that this was despite taking away 20% of all the drugs for hypertension that I was prescribing. So we were getting significant improvements in blood pressure despite significantly fewer costs on the drugs for hypertension. And how interesting. It might be useful at this point if I could just discuss how I can make all of these things, how we can pull it together and help people remember about the physiology. So let's see how I do. So this is how I explain to my patients in the north of England. And we'll see if people continents away can get it as well. So we have a hormone called insulin. The hormone insulin is produced by the pancreas gland in your abdomen, and it has a very special job to do. Insulin's job, its purpose in life, is to reduce blood glucose. And this is because a high blood glucose over time is damaging, and it's damaging to the blood supply of your eyes, the blood supply of your kidneys, and the blood supply to your legs. This is why type 2 diabetes is dangerous, because It's a condition in which your blood sugar tends to be high, and a high blood sugar over time damages vital organs. So insulin's job is to get that blood sugar down. In the case of diabetes, it's not able to do that job very well, and because of that, your blood sugar is raised over time. But despite this, insulin does its best, and it gets rid of sugar out of your bloodstream by pushing that sugar into cells away from the blood. And it pushes the sugar into your belly fat. Over time, that is turned into more fat, and you end up with a bigger belly. And how many of us in middle age have noticed our bellies getting bigger? I used to think it's just age, but it isn't, because my belly now is as small as it was when I was about 30. So insulin pushes sugar into your belly to get rid of it. Insulin also pushes sugar into your liver. And the only thing your liver can do with all this sugar is turn it into fat. And you end up with a fatty liver. Now, fatty liver, unfortunately, interferes with the work of insulin itself, so that the insulin doesn't work as well and you become insulin resistant. So against all of this, it makes perfect sense to eat fewer things that turn into sugar. Because why eat something that you struggle to deal with? Why eat something that you struggle to metabolize? And so for me personally, sugar is a kind of poison because I can't deal with it. And sugar makes me feel drowsy. It gives me a big belly and a liver full of fat. And so I'm very reluctant to eat sugar. But just as that very wise lady pointed out to me in 2012, eating starchy carbohydrates like bread, like rice, like potatoes is perhaps unwise because it digests down into the very thing that people with type 2 diabetes struggle to metabolize, and that's a sugar called glucose. And really, that is the basis, as I see it, of the low carbohydrate diet, where I'm hoping that people will eat more healthy green food, eggs, meat, fish, but avoid sugar and also the starchy carbohydrates that digest down into sugar. And as from what I've seen of the D-Life India website, this is what you're basing your recipes and your advice upon. Is that correct?
That's true. And doctor, thank you for explaining this entire concept in a very simple language about insulin, about sugar.
I hope it's helped.
And as we say, starchy carbohydrate are nothing but complex sugar. So yes. While we know that sugar has to be reduced, so do we reduce carbohydrate as a whole? Yes, because that is also complex. Ultimately, it's going to break down into sugar. So you're very famous for your sugar equivalent infographic. So please do tell us how you hit upon this brilliant idea. And,
yes.
You have shown, how much is, let us say an Indian equivalent, let us say a basmati rice, a bowl of basmati rice is equal to so much sugar. Yes. Maybe some bread is equal to so much sugar. So please just give us some information on this.
So if I just start by explaining the sugar infographics. So I was trying to communicate with my own patients so that they would have a better understanding of how different food choices may affect their blood sugar. I'll give you an example. So the infographics show the number of teaspoons of sugar that are equivalent to various food portions. And an example would be a bowl of 150 grams of boiled basmati rice, which is not a large bowl of rice, may affect your blood glucose to the same extent as 10 teaspoons of sugar.
Wow.
So that can't make sense to have 10 teaspoons of sugar. So you have to ask whether it's a good idea to have a bowl of basmati rice. And maybe you might have some green vegetables or something else, or some eggs, or some fish, or some meat. These things would not affect your blood glucose to the same extent as 10 teaspoons of sugar. And a small amount of bread, a few slices of bread, will affect your blood glucose to the same extent as 6 teaspoons of sugar. But now that you understand, or you've got some idea of what I mean by this teaspoon of sugar equivalent system, I'll explain how it came about. So I was searching for an easy way to explain to both my patients and also the people on Twitter around the world how starchy foods might affect their blood sugar. And I came across a thing called the glycemic index and the glycemic load, which are scientific principles with quite a large body of evidence, which explain in a complicated way how starchy foods affect your blood glucose. But I found that it was too complicated to use either the glycemic index or the glycemic load to explain to the doctors in my practice. They found it confusing, and they said, please think of a way to explain to us about glycemic index and glycemic load in a way we can understand. And when I looked at the idea of the glycemic load, it explains the effect of starchy foods on blood glucose in terms of grams of glucose. And really, my patients have no idea what 10 grams of glucose looks like. They're not sure about grams, and they're not sure about glucose as a substance because they don't use it to cook with. And so my idea was I need to communicate this equivalence in terms of a substance you are familiar with, which would be table sugar. Everybody buys table sugar all over the world. And also in terms, in volumes you're familiar with. And most people know what a teaspoon of sugar looks like. So I got together with an international expert on the glycemic index called Dr. Jeffrey Livesey. And he very, very kindly reworked the calculations for 800 foods in terms of teaspoons of sugar. And that's how I know that a bowl of boiled basmati rice may well affect your blood glucose to a similar extent to 10 teaspoons of sugar. Whereas if you were to have, for instance, a 3-egg omelette, do you have omelettes in India?
Oh, yes. Oh, yes.
Excellent. Well, if you were to have a 3-egg omelette, and you could add herbs to that and maybe some cheese, or some meat of some kind, or all sorts of things can be added to an omelette, that will affect your blood glucose perhaps less than 1 teaspoon of sugar. So which food is the wiser to eat? That's the use of the teaspoons of sugar equivalent there. And there you have it. And if you wish, there are 8 different infographics. And as I say, you're so welcome to download them and put them on your website and see what your members make of them.
So, of course, in India, it's a little challenge in the sense that, we have a lot of vegetarians here. However, for vegetarians, there are various options available. We do have a lot of dairy products. In India, vegetarians take dairy also. So whether it is paneer, whether it is cheese, whether it is what is called as yogurt, or we call it curds here in India.
Yes.
Or we call it hung curd. And a lot of non-starchy vegetable options are available.
Excellent. And I would just say that ghee is wonderful stuff.
Yeah.
Do you cook with ghee? I think it's...
In India, again, the vegetable oils are very rampant. I mean, as usual, as across the world, all the saturated fats like ghee, butter are all demonized. And we do use ghee.
Yeah.
But,
so at home, we use a lot of ghee because it has it doesn't tend to burn like butter. So it's a much better basis and it's delicious. And we find that the lipid profiles are fine with butter, with ghee, with lots of cheese and full fat dairy. So I've started to worry rather less about having full fat dairy. And I think there is some more recent papers on this to say that probably we shouldn't worry about full fat dairy. Anyway, that's perhaps a minor point and I interrupted. I'm sorry, back to your point.
No, I mean, okay, yeah, we do have options. There are options available for all vegetarians also. And the best part about adopting low carb is we don't require frequent meals. This is one of the best part. Yes. So, like personally, I have only 2 meals a day. So
me too.
So there are no hassles of having 3 meals and then 2 or 3 snacks. So everything goes off, and then a lot of low carb options are available. Yes. All real food. So we don't mean those. And
just to explain a point to your viewers, because you've said a lot of wise things. Then the one I'd pick up on is avoiding snacks, because the more you snack, the hungrier you will become. And I got into a dreadful habit of eating biscuits all day long. And you're still just as hungry for your dinner, whether you've had 1 biscuit or 10. And this is because of insulin. Yeah. Because when I eat, maybe I'd have 5 biscuits. If I ate 5 biscuits, my blood sugar goes up. Insulin reads this as a danger signal and pushes all that sugar into my belly fat. As a result, the blood glucose drops and I'm hungry again and ready to go back to the packet of biscuits. And I used to go round and round and round, snacking all day long. In my drawer, as a doctor, patients used to bring me chocolate biscuits as a special gift. And so I was plentifully supplied with lots of biscuits, which I ate all day long. And no wonder I ended up with type 2 diabetes and a big tummy. And now I ask patients to bring me almonds if they must, something. But I would avoid snacking, and you make a good point. Yes.
So the options are available for those who think. So there is no issue. And as I had explained, while insulin is a vital hormone, so in sufficient quantity, yes, it is beneficial. In excess, it can create a lot of issues. Yes. So I think, while appreciating its role, we also need to be a little cautious about insulin. So, Doctor, how is your experience with, let us say, ethnic Indian patients in your country? So, how is it? How is it about them? Do you see Indian patients who are settled there, yes, or NRIs, or how is it?
Oh, yes. I have a close friend called Dr. Kesar Sadra, who maybe you could get on your on the podcast. He has a very large Indian population just west of London, and he's a close friend of mine, and he's achieving results just like mine. And also I have had Indian patients obviously within the practice. And what was interesting is I learned perhaps more interesting styles of cooking from them, because their use of spices and herbs is so exciting to us. And there was one lady particularly used to offer to cook low carb treats and bring them into the practice. And again, I think the other thing about the Indian population is in some ways you're particularly vulnerable to type 2 diabetes. And we're seeing it in the West, in people from India at a younger age group. And they're not always that heavy. But what I do notice is it begins with a larger tummy. And I think, so people from India, they're not always very heavy, but they do seem to have this large tummy, which in my clinical experience shrinks down quite rapidly. Is that your experience?
That is true. That is true. I mean, I think the concept of personal fat threshold,
Yes.
It may not be known by many, but however, it is very common in the low carb world. So we
Yes.
Indians have a lower personal fat threshold. We are the
Yes.
leaner, but the moment we see a tummy, so at least I know, and a lot of our people in the group know that this person can be actually classified as an obese. He may not be overall obese, unlike the Caucasians, unlike the Westerners. So while a person can be lean, however, if we see his blood report, it can be, it can be really messed up with very high triglyceride.
So I work within the National Health Service. I don't have any private patients, so there are constraints upon me in terms of the number of tests that I can do, as there will be constraints on you in India. But I find a tape measure round and be honest about the size of your tummy. Men always put the tape measure under the bulge, don't they? And try and pretend the belly's smaller than it is. But I would say, if you're going to be accurate, you should measure your belly around its widest circumference and be honest about it. And it's one way to very cheaply monitor your progress. And if your tummy is growing larger again, it's possible that you're suffering from what we call carb creep, where you're just beginning to have a little bit of rice here and there, maybe the odd biscuit. And that for my own patients, if they start to drift, it's something I'd always say, I wonder why your tummy's getting bigger again. Have you got any ideas as to why that may be? And often they know why it is. Yes.
I think it is also a good indicator of fatty liver disease somewhere hiding. So unless we get a USG done, so we may not know that we have fatty liver. And in India, it's again, I think it is a big issue that many people have unrecognized or undiagnosed fatty liver.
I'm certain that will be the case. I'm certain that will be the case because you've got this rising tide of central obesity, high blood pressure, and type 2 diabetes. And I went to Malaysia recently, and again there I saw exactly the same. And I have friends who are doctors all over the world, and there are very few countries who are not experiencing this. Japan is one of them. And there are one or two others, but most countries around the world. And I'm tempted to think that aspects of the Western diet are to blame for this because of our use of refined carbohydrates and sugar and sweets and the McDonald's and so on and so forth. And I sometimes wonder if we ate more like our grandparents, whether that might be rather better for all concerned.
I think the influx of this modern processed food is quite high in India. So all these pizzas, burgers, biscuits, and all this sugary beverages have become the in thing. In my childhood, something which we used to have maybe once in a while, once in a blue moon, and we never heard of all these stuffs actually. And today, I think most of us have it at least once a day. So this is something which is...
It's interesting. That's an international phenomenon because as a child, I was allowed sweets on a Friday only. And my mother didn't buy orange squash or sweet drinks at all. We drank mainly water. And occasionally she made homemade orange juice for us. And now people are having treats and sugary drinks every day, all day. And in my opinion, this is why I'm seeing younger and younger people with type 2 diabetes. So again, as a young doctor in 1986, I never saw anybody under the age of 50 with type 2 diabetes, not a single case. And in fact, we called it maturity onset diabetes because it was supposed to be a disease of old people like me.
That was how it was known earlier.
Yes, I never saw younger people. And now they're often in their 30s, often. And the youngest I've seen is 10 years old. And what will the future of that 10-year-old child be? And I believe that changes in dietary pattern to do with snacks and treats day after day is bombarding you with sugar we can't deal with. And it makes me upset, really, to see people ill who shouldn't be ill, and to see unnecessary suffering. And this is all around the world.
I think it's very interesting to quote here, somewhere back in 2016, there was a study conducted in Mumbai, and then they found out that the affluent section of Mumbai, the school-going children actually suffer from fatty liver disease. In fact, they also found some of them have fibrosis. I can always forward that study to you. I do have it with me.
Yes.
And sometimes I do quote it in Twitter also. It is terrifying.
Yes, I'd be interested, but also horrified. And when you think, what is the future of children with fatty liver disease and fibrosis? Can they ever be well? And I think the tragedy of this is all of us love our children. These are loved children, and we are rewarding them with treats. And how is that we show love to people by buying them chocolate and sweets? And it's the very last thing we should be doing. We should be rewarding children with books or with attention or with hugs or play. We shouldn't be rewarding children with sweets day after day. I think many parents as well, I've noticed this in clinical practice. I'm faced with obviously obese children. And if I say to the parents, I'm a little concerned about their weight, the parents are annoyed and they say, oh, he's just chubby. It's just baby fat, this kind of thing. Children are much fatter than they were 20 years ago, and it's a worry. It's a worry, and it's something that needs a lot of thought, and I agree with you completely that our entire food system is based on treats and sugary things rather than nutritional density. A treat for a child is an egg because it's wonderful nutrition. Or it may be some meat because, again, of the wonderful nutrition. Or it could be almonds, which are wonderful nutrition. But sweets contain nothing that's going to help a child. Nothing.
And even, I will say that in India, the other biggest issue is, which is not recognized well, is the refined vegetable oils. I mean, it is,
yes.
We personally believe that it creates a havoc in India. And it is not just those oils, it is the reuse of these oils. In fact,
absolutely, because they're not, I so agree with you, because they're not stable. And we know that over time, this reuse of oil, particularly for frying, which is very, very common in Asia, is probably releasing carcinogens.
Yeah.
And I have seen in the West an increase in many different cancers. This, I believe, is partly it. It's also, of course, that a big belly is associated with 8 different cancers. Breast cancer is one, but there are 7 others. And having a large belly, I've certainly seen an increase in colorectal cancer in clinical practice since 1986. But yes, I advise my patients not to use vegetable oil, which is a sort of factory production. It's a weird thing. And yes, I do worry about vegetable oils. Yeah.
So when we say vegetable oil for viewers in India, it means our sunflower oil, our safflower oil, and soya bean oil. Corn oil may not be very frequent here. And even this refined bleach deodorant. Yeah, I was just coming to
palm
this.
Oil.
Refined bleach, deodorized palm oil or RBD palm oil is very frequently used. We also use what is called as trans fat or vanaspati, especially for the commercial purposes. So this is again quite dangerous. So
trans fats?
It is openly used.
Crikey. Haven't they been outlawed in America about years ago?
I mean, people declare it openly in any of the packaged food that contains trans fat.
Good heavens. If you saw trans fats on a packet here in Europe, you'd be appalled. And I'm sure in America, they're outlawed. Heavens, right.
So unfortunately, this is the sad part and we don't realize this. So that is why we say that some of the fats for India are good cold pressed coconut oil, butter and ghee. Or I will say in the order coconut oil, ghee and butter in this order are one of the best oils which we can actually use.
Just to ask something, but presumably a factor for people in India is the affordability of low
yes,
carb.
affordability yes, it could
what
be.
Would you say, because that's also something we debate here in England about the affordability.
That's an issue. That's an issue.
Yeah, but
the
again,
oils are cheap.
Yes, but it's this what I asked my poorer patients about this very subject, and it was interesting what they said. They said, if you're honest about how much you were spending before in terms of Coca-Cola, sugary drinks, sweets, biscuits, if you're honest about what you waste on rubbish food, if you spend that same money perhaps on eggs or butter, or very cheap cuts of meat or tins of fish or whatever, the cost of low carb in the UK does not have to be high. And that these are some of my poorest patients living on benefits from the state who are able, with care, but you have to have cooking skills. And some of the younger people now are not so sure how to cook, because vegetables are very good value. So vegetables cooked in ghee as a stir fry is nutritionally great, and actually cabbages in the UK, pennies, very, very cheap. So what about cooking in that way in Mumbai? Do you think low carb is doable?
Yeah, it is doable, perfectly doable. I will say the other way, that instead of having 6 meals a day, if we have only 2 meals, that itself is going to cut down the cost drastically, and we may as well spend it on good food. And vegetarians need to think properly and do it. It is doable. Yes, sir. Yes, doctor.
Yes. So I'm just coming back to what you say. I agree. Eat less, but better quality. Go for quality, whatever your budget is. And as I say, a single egg is nutritionally complete. It has everything in it to produce. Yes. You're going to say,
very affordable. I will say it is very, very cheap.
Yeah. And there's everything in the egg to produce a chick. So there's everything you need for life in an egg. And as I say, for children, what wonderful nutrition. And if it's affordable in India, how much is an egg in rupees?
It is just 5 rupees.
Right. So they are affordable. Yeah.
So very highly affordable. And if we don't
I would say if you can, keep hens. So I keep hens here, and they eat the rubbish that we don't eat and turn it into eggs. So I've got 4 hens and a cockerel. They cost very little.
So as an option, low carb is there. And I think you also agree that now it has become mainstream also, in the sense that American Diabetes Association and Diabetes Canada also have an option of LCD, low carbohydrate diet, and VLCD, very low carbohydrate diet.
I agree.
That's been therapy.
Yes, and Scotland as well has similarly come in. But America was the big one, where it becomes an option, hopefully for people all around the world. But the Americans have led the way there. Yes.
Yeah, anyway, I mean, we follow all the Western guidelines. So there are at least 2 countries where they officially put in their guidelines, and it's a clear-cut legal option, I will say. I will use the word legal option for anyone to recommend this and anyone to go for this.
Yeah.
And,
so I would always say there are different ways to sort diabetes. Low carb isn't the only way to do it. You could have bariatric surgery. That works. That does work, but it's rather a big operation. Or you could try, Jason Fung, and you could try intermittent fasting. Well, that works as well. And I would say for patients, if you can, weigh up the different things, discuss with your doctor and see which one would suit you personally. I have found, for me, low carb is very convenient and has worked for 7 years. So I'm happy. I'd be very sad to have bariatric surgery.
So, why to go for complicated surgeries when we have real food? That's what I say. Real food and fasting. I mean, this is an option which each one of us can combine.
Yes.
And
of course, bariatric surgery, all it does is stop you from being able to eat the food you shouldn't have eaten in the first place. So it's like a low food jail. You know, when I started as a young doctor, I used to be able to have my patients have their teeth wired together. And that worked like bariatric surgery. But it's a very distressing, violent thing to do to a patient. But I've seen bariatric surgery work well, but I've also seen it go wrong. And it's a serious thing to consider and very expensive. And it by no means is the answer. We can't possibly cure diabetes for the world by operating on all the young people and giving them bariatric surgery, can we?
So, thank you, Dr. Unwin. I think you have a hectic and busy schedule ahead, and you have really given us your time, and I thank you very much. This message is, do you have any one final message for the Indian population?
Yes, I do. I've been thinking about that. I'm a great one for hope. And I would say the thing about low carb is it gives us all hope, rich people, poor people, all over the world, that diabetes does not have to be a chronic, deteriorating condition. The idea of drug-free diabetes remission, where now it's 83 of my patients have achieved this, so normal blood sugar without drugs, I've achieved that 83 times. And I know there are people all over the world on Twitter who have done the same. And I think for India, it would make me so happy to hear that you are having more and more people who, instead of diabetes being a chronic condition getting gradually worse, how wonderful if commonly you would know of people who have put their diabetes into remission. I call it remission rather than reversal because, of course, if you go back to eating sweets and sticky rice, it'll come back. So that's my message of hope, really. Type 2 diabetes remission is perfectly possible wherever you are in the world. And it needs a bit of research and dedication, but good health is always a wonderful goal. Thank you so much. Thank you.
Thank you, Dr. David Unwin. And my message is diabetes is not a chronic progressive disease. You can bring it under remission. Sometimes I say that diabetes is not a curse. It is actually a blessing. For me, it is a blessing because I found the healthy road, and by cutting down starchy carbohydrates and having more let us say fatty protein food and non-starch, a lot of non-starchy vegetables, I have reversed a lot of health condition, including diabetes. So diabetes is not the only one. So there are a lot of other associated ones.
Just as we said before, you will also sort out your blood pressure, your fatty liver, and all of the bad things that happen because of those two things. So it's nice to end on a cheerful note. And the sun is shining outside now, which is rare in the UK. The rain has stopped. So I'll say goodbye to you all now. And thank you so much.
Thank you, Doctor. Thank you for sparing your valuable time. Thank you.
Goodbye.